Looking at the plantar flexion muscle or movement is when your toes point down in an open chain, or if you're rise up on your toes. But we can see that plantar flexion is due to the posterior muscles. And if we go back to the sagittal view, the line of action of these muscles is posterior to the ankle joint. And so when they shorten, they pull the toes down into plantar flexion. So the posterior muscles behind or posterior to the ankle joint create a plantar flexor torque. And so let's look at those muscles. The big one is your gastrocnemius, nice two biarticulate muscle. Then you have the soleus, which is a one joint muscle. So the gastrocnemius goes, it attaches onto the femur. So it's a knee flexor and a plantar flexor of the ankle. The soleus is just a plantar flexor of the ankle. And then you have the deep muscles, which we call, let's see, let's hide this one, which we call Tom, Dick, and Harry. So tibialis posterior, flexor digitorum longus, and flexor hallucis longus. So they're doing something at the toes, but since they're posterior to the ankle, they also help in plantar flexion. So let's look at some details of the posterior compartment. And again, the muscles posterior to the ankle joint create a plantar flexor torque. So they plantar flex that joint. All the posterior compartment muscles are innervated by the tibial nerve. Again, you want to put what's similar to all these muscles together to make understanding the motion of plantar flexion and the muscles that create that torque easier to utilize in your careers. All the muscles share the function of plantar flexion at the ankle, and they're typically separated into three layers: superficial, intermediate, and deep. So let's look at the superficial layer. It's the gastrocnemius. That is a large superficial muscle. It has two heads that are attached to the medial and lateral epicondyles of the femur. So it is a two joint muscle. So it crosses both the knee joint as a knee flexor. So it creates knee flexor torque, and at the ankle joint as an ankle plantar flexor, creating ankle plantar flexor torque. Then we have the plantaris, which is a really small muscle attached on the lateral supracondylar ridge of the femur. It's super weak. It's technically a plantar flexor, but it has this long tendon. So functionally, it's not doing much. So sometimes that tendon is used for any sort of reconstruction. And let's go up and look at those. So here's our gastroc. The plantaris is cut. Oh, you can see the plantaris peeping out right here next to the lateral head of the gastroc. And just to talk about the neural innervation, right? So the sciatic nerve is coming posterior. Let me just change that color. And then it splits. The tibial nerve runs down the back of your leg, and then it splits into the tibial and the common peroneal nerve, or the common fibular nerve. So some books will say fibular for all the muscles and the nerves, and that's the book you're reading. Some books say peroneal. So fibularis and peroneus are synonyms. And then once you cut the gastrocnemius, you can see, well, the soleus is cut here, and then you can see the three deep muscles, the tibialis posterior, flexor hallucis longus, and flexor digitorum longus. All right, so back to the text. The intermediate layer is comprised of the popliteus, which unlocks the knee joint so it can move from extension to flexion. So that's the the locking mechanism, and the soleus, and that's deep to the gastrocnemius. It's a very powerful plantar flexor, and it attaches with the gastroc and the plantaris to the calcaneus via the Achilles tendon. So let's go back here and see if we can see um, the popliteus is cut on here too. So we'll see it in a future slide. All right, so we had the superficial layer, the intermediate layer, and now the deep layer. These muscles are called Tom, Dick, and Harry. So Tom is tibialis posterior, Dick is flexor digitorum longus, and Harry is flexor hallucis longus. Anything with hallucis, you know it attaches to the big toe. They pass posterior to the medial malleolus, which is why, since they're posterior, that's why they are plantar flexors. And from anterior to posterior, they pass the medial malleolus as Tom, Dick, and Harry. If you're looking at the muscles in mid-leg, like dissecting down into the leg compartment from medial to lateral, it will be Dick, Tom, and Harry. So kind of verify that when you're able to see a picture or the models in class. So the deep layer, tibialis posterior, it plantar flexes the ankle joint. It's also an inverter of the ankle joint along with the tibialis anterior because it attaches on the medial side. Flexor digitorum longus flexes the joints of toes 2 to 5, so it curls your toes, and it's also a plantar flexor of the ankle joint. Flexor hallucis longus attaches to the fibula and flexes the joints of the great toe and plantar flexes the ankle joint. And we can see here the deep view. So you have the flexor hallucis, the tibialis posterior in the middle, and the flexor digitorum on the most medial side. And if you're going to look at, this is the medial malleolus. If you're going to look at how they go behind the medial malleolus to their final destination, either to the hallux or the digits, it will be tibialis posterior, the first one, flexor digitorum, and then flexor hallucis longus. And the tibial nerve is also going through there, as well as the tibial artery. All right, one more view of the posterior compartment muscles. And just to orient you, and we'll repeat this again and again, the posterior muscles are the plantar flexors because based on the line of pull, they're posterior to the ankle joint, and so they plantar flex, and that's a motion in the sagittal plane with the medial lateral axis. The anterior muscles, since they're anterior to the ankle joint, create a dorsiflexor torque. Again, sagittal plane, medial lateral axis. Then you have the lateral muscles, which work in the frontal plane motion of eversion. So that's in the frontal plane with an anterior posterior axis. The medial muscles, which attach medially, and it'll be the tibialis anterior and the tibialis posterior. So one from the anterior compartment and one from the posterior compartment, attaching medially to invert the subtalar joint in the frontal plane with a medial lateral axis. All right, so the posterior muscles, again, they're plantar flexor torque generators. It's the gastroc and soleus, the plantaris, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. So here we see the gastrocnemius, and then the plantaris is up here near the lateral head. And then if we go a little deeper, again, we'll see the gastroc as a solo muscle. We'll go deeper to the soleus. What's unique about the gastroc, sorry, I'm just going to jump back here, is just notice that it does cross the knee joint. So it's a knee flexor and a plantar flexor, a two-joint muscle. And then we get to the soleus. It does not cross the knee joint. And so it is an ankle plantar flexor. It shares an insertion on the calcaneus via the calcaneal or the Achilles tendon with the gastrocnemius. The plantaris, you can see, is this wee little muscle up here with this very long tendon. And so sometimes that tendon is used if you need any sort of reconstruction, ligament repair, tendon repair, etc. Then we get to the deep muscles, the Tom, Dick, and Harry. So we have the tibialis posterior that goes to the medial side. It attaches on the posterior on the interosseous ligament between the tibia and the fibula and goes to the navicular. So you'll read about that if you have shin splints or medial tibial stress syndrome. The flexor digitorum longus comes off the tibia, and here's a plantar view of the foot, and it goes to toes 2, 3, 4, and 5. Because the hallux, or the big toe, has its own muscle, the flexor hallucis longus, that goes to the proximal phalange to flex the hallux, and also, since it's posterior on the medial malleolus or the ankle joint, it will also be a plantar flexor.